TB is really an old boys club. HIV, they are a younger generation. They come from an activist mentality. And I think that they're the ones that should be running with the TB HIV program.
May I just respond on
There's
that?
a question over there.
What I mean by norms is we must have a look. How many doctors, how many nurses do we need in our country to address, let's just look at TB, HIV. Then we must say, how many do we train? And if we train people, why can we not keep them in our country? I mean, these are really the big questions we have to address.
We don't have enough staff. And again, when the issue of HIV came into place, the activist TAC was mainly, advocating about HIV, not advocating about the very TB that we're talking about. And TB was sort of a mass-driven program.
There's a theme, obvious theme that's going through all these presentations, and that's stigma. All the speakers have mentioned it. And somebody said the source, a very prominent source of the stigma is the health workers, we ourselves. And one can't help in trying to think how to prevent and manage that, how little support the average health worker, and I'm talking especially about nurses, gets. And I won't say what country I come from, it's obvious, but I'd like to hear what some of you say. In so many large organizations where the staff have so much less responsibility for human lives, the material incentives, the motor cars, the housing allowances, you name it, the support, the retreats, all the fancy occasions to help staff relax and come together, they're in stark contrast to what happens to our health workers.
We're talking about we don't have enough doctors, we don't have enough nurses. I haven't heard anyone talking about the community care workers. We have to task shift to them, and integration has to happen at community level. That's where the passion actually could come from. And if we involve the community, we diagnose people earlier. As you said, nurses could initiate antiretrovirals and TB treatment because they're not the complicated cases. So I think we really have to put our hands out now and not just give lip service to community health workers. Let's make them part of our team and use them.
If South Africa doesn't have the resources, then the rest of Sub-Saharan Africa has even less a chance, because you're the most well-resourced country in our continent after all. So indeed we need a balance. We need the norms and policies and practices, but at the same time we also need to perhaps consider what is morally correct. So we, for example, in Zimbabwe can't have the doctors who are often working in your country or in University of Alberta, in Edmonton, etc., Calgary, to provide the services. So HIV care is largely provided by nurses. I want to recognize what you say. Zimbabwean nurses are exceptionally well trained. So all the ladies over here who've been calling for capacity building, it's very important. It's not just post-basic training. I think even the undergraduate training, it's very important that we look into the curricula.